Hello, my name is Tamara Springer, and today I'll be talking to you guys about childhood diarrhea. This is for Medical Nutritional Therapy, Spring 2018. A brief overview. Today we'll be introducing the topic, and then we'll talk about diarrhea, the etiology, risk factors, treatment and management, prevention, and additional resources. Developing countries, also known as third world countries, are defined as nations having lower living standards, low industrial base, and low human developmental index. These newly developed countries generally have a workforce based in agriculture and have a less stable government. Without government intervention, citizens of developing countries have substandard education, healthcare, and housing. Some developing countries include Cambodia, the Dominican Republic, Korea, Niger, Poland, and Yugoslavia. Diarrhea is the second leading cause of death in children under age 5 worldwide. Children in developing countries are at a greater risk of developing diarrhea, yet they receive lesser quality health care. Diarrhea is defined as the passage of 3 or more loose liquidy stools per day. Diarrhea is usually caused by an infection of the GI tract, and these infections can be caused by a plethora of bacteria, viruses, and parasites which are passed from contaminated food, water, or poor hygiene, as well as person-to-person interaction. There are 3 classifications of diarrhea: acute watery, which lasts for several hours or days; acute bloody, also called dysentery; and persistent diarrhea, which lasts more than 14 days. Risk factors for diarrhea include lack of refrigeration or water coolers, age and education level of the caregiver, male, poor hygiene, low income, contaminated water, and poor food preparation practices. This image shows various modes of transmission for diarrhea. It can be passed from a sick person into the water supply or food supply, which is then consumed, or the infection can be passed from a caregiver to other people or even to the food during preparation. Diarrhea can be treated by using antibiotics and antiviral medication to attack the microorganisms causing the infection. The dehydration that often comes with diarrhea can be treated by increasing fluid intake or via the use of oral rehydration solutions. These solutions contain necessary electrolytes, which include sodium chloride, potassium chloride, and trisodium citrate, as well as anhydrous glucose. Dietary changes can also aid in the treatment of diarrhea. Soups, oatmeal, steamed rice, and lightly seasoned proteins have showed great benefit in treating diarrhea. The World Health Organization and UNICEF propose 5 interventions for preventing death caused by childhood diarrhea. These interventions include exclusive breastfeeding for the first 6 months of life, which provides the baby with antibodies from the mother, access to clean drinking water, good personal hygiene in food preparation practices, rotavirus and measles vaccines, and nutrient-rich diets. Currently, there is research occurring in developing countries to identify the main causes of diarrhea in those regions. The data shown to the left is for diarrhea in children in Burkina Faso, which is a country in West Africa. Here we can see that the majority of children infected with diarrhea are between the ages 0 to 12 months. The data also shows that E. coli is the prevalent cause of diarrhea. If you are interested in finding more information about childhood diarrhea in developing countries, you can visit the World Health Organization, UNICEF, or the Center for Disease Control.